Hey guys, I'm Caitlin Johnson, and the assessment test that I had and we'll be talking about is the Barthel Index Scale. This is an ordinal scale that is used to measure performance and functional independence in activities of daily living and mobility in patients that have chronic conditions. Specifically, this test is designed to assess stroke patients, patients with Parkinson's disease and brain injuries, older adults in geriatric care, and non-specific populations. The population that I'm going to be talking about is older adults with Parkinson's disease. I do not have the equipment to demonstrate this assessment, but if you want more information on this test, you can look at the resources that I found in my reference list. There are 10 items that describe ADL's mobility that are scored. These include feeding, bathing, grooming, dressing, bowel movements, bladder control, toilet use, transfers, mobility on level surfaces, and the ability to walk upstairs. The patients receive one of 3 scores for each of these activities, 0 meaning they are unable to perform the activity on their own, 5 meaning the patient needed some assistance but could still do it, and 10 is a reflection of a greater ability to perform and function independently. The scores for these 10 items are then added up, and the higher the score the patient has, the more independent they are. The time to administer this test takes 20 minutes and does not require any training to carry out the assessment, so it is relatively easy as you just use paper and pencil and the patient just performs a task and you rate them on their performance. This is a norm reference assessment as it has a specified population and looks at fluctuations in motor performance between on medication, which is when symptoms are controlled by taking medication, and off medication when symptoms are present. One article that I found reported that the Barthel Index Scale had excellent internal consistency with the Cronbach alpha's coefficient greater than or equal to 0.8 for on medication and 0.88 for off medication. This test also showed excellent retest reliability with 95% agreement. However, there was still a little bit of considerable variability. This article also showed excellent inter-rater reliability. As for correlational statistics, the article that I found had a correlation coefficient of greater than or equal to 0.2 and was considered acceptable. It also reported 3 different types of validity: discriminant validity, face validity, and construct validity. All the resources that I found really focus on construct validity as it is a standard long-term measure outcome for patients with Parkinson's disease. It was considered acceptable and is used to measure the degree of disability in patients with Parkinson's disease in both on and off medication, and compared it to other tests such as the modified Rankin scale. I would use this assessment because it is designed to evaluate motor skills of patients who had just suffered from a neuromuscular or musculoskeletal disorder, and I think that it does an excellent job of doing that. And it's also very used often. And I would also use this because the pros outweigh the cons. The assessment is free and does not require any training, so it is very easy to administer. And the con is that most of the patients have a mild or moderate level of Parkinson's disease, so individuals with low disability were overrepresented, which can decrease the possibility of discrimination between patients. Like I said, if you have any more questions or interested in learning more about the Barthel Index Scale, you can look at the resources that I included in my reference list.